So, welcome everyone to Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. I'd like to thank you guys all so much for your Facebook, YouTube, and Instagram connections with me. Please don't forget to do your medical checks and seek as many opinions as possible. Now, we all know that February is Heart Health Month. And of course, if our heart doesn't beat, we don't exist, do we? So we all know that that's the end of the road. For cancer patients and survivors like us, we have been cautioned that there's certain interventions that we undergo that have negative effects on our hearts, on our cardiovascular system, even as they extend our lives. And so this is very, very scary. Therefore, in this episode, to shed more light, I'll be discussing with an expert and stakeholder in this regard. He's a highly accomplished individual. He is one of the best in his field. He's a cardiovascular disease specialist. He's the founder and director of Apex Heart and Vascular Care, New York City. He holds 7 board certifications in cardiology and interventional cardiology. He graduated from one of the top universities in India, Gujarat University, and was trained in complex cardiac and vascular cases in the famous Mount Sinai Medical Center in New York. He has published more than 50 articles and abstracts in peer-reviewed journals. Anyway, guys, this is just the tip of the iceberg, as he will be telling you more about himself. So, ladies and gentlemen, let me welcome Dr. Anuj Shah to the show. Welcome, Dr. Shah, and I'm so glad you found the time to come on. We appreciate this very much.
Grace, thank you so much for having me. Absolute pleasure being here. And it's a great Friday afternoon, and I'm super ecstatic and super excited. And thank you for that wonderful introduction. Love seeing what you have created here, love seeing the smile, and super psyched. So, once again, thank you.
Thank you so much, Dr. Shah. So please, let's dive straight into the show. Do tell us a bit about yourself. I've already said so much already, but I want to know what that little boy was, your childhood, school, family. Do tell us a bit about that.
So I grew up in India, in Gujarat, India, which is the sixth biggest city in India, Ahmedabad.
Mm-hmm.
I was a good student, growing up. My parents are both physicians. Looking at them, my dad is big in academics. He was the president of the Indian Academy of Pediatrics at that time. So from childhood onwards, I had aspirations to actually make a difference in people's lives in some capacity, whether it was by healing them with whatever ailments they had or teaching them and create and help with the next generation. Grew up in India, came to the US for further studies and education. I went to University of Connecticut and ended up doing my residency in internal medicine, and then eventually went into the field of cardiology. And then, as you mentioned, I was very fortunate to get my further training at Mount Sinai Medical Center in New York City in Upper East Side, which is considered one of the top centers in not only in the country, I would say in the world.
Mm-hmm.
Where we tackle complex cardiac disease that most people would otherwise shy from. I was fortunate to get training under some of the mentors who are considered like who's who in the profession and field of cardiology, and very excited that it's a very privileged position to actually be able to make in people's cardiac health, because heart health, as you know, is no joke, and it's a very privileged position. I feel humble and grateful every day being in a position where people entrust us with their cardiac health, being able to go and make a difference, whether the difference is just holding their hand and telling them everything's okay, you just need to take these medications or do lifestyle modification, or if it's something where we go and we do a life-altering treatment or therapy, interventions, procedures, surgeries, whatever they need, that
Wow.
can not only impact their own lives, but lives of their family members, their friends, their beloveds. So
Mm-hmm.
again, very humble to be in that position.
And I'm sure that everybody is so smitten by you, because you have that aura, a big brother, a loving son that makes cases, I'm sure, much better with your positivity. That's excellent. So
No, yeah, the personality of a person definitely comes across. I often joke, not joke, actually, it's true that we are in the business of healing hearts.
mhm,
So you can't heal hearts unless you heal the soul and mind first. So I do focus on
absolutely.
that, and thank you for those kind words.
Oh, that's okay. It shows, it comes across. So that's why I mentioned it. So now, as a cardiovascular disease specialist, for those that are watching, what is it that you do exactly?
So there is a spectrum of disease, right? It starts from people who are at risk of developing cardiovascular disease. Our job is to go and make sure A, they don't develop disease, do everything in our capacity to prevent it, along with the patient. It's a team game. So we work together, we come up with a treatment regimen and treatment plan, and then we extend it all the way to the other spectrum of the disease where people already have formed heart disease. What are some of the most common heart disease is blockages, coronary artery disease, which is or ischemic heart disease, which is when people already have blocked arteries in the heart, congestive heart failure, which means the heart is not pumping enough adequately, or arrhythmias when people have irregular heart rhythm. So those are the three of the most common form of cardiac disease, but there is a whole wide variety of heart disease. And no matter what people have, we provide the right treatment, we provide the right investigative therapy and surgeries if they need, and I do it all. I take pride in being what my friends like to call me, the cat lab ninja or cat lab gladiator. So we go to the cat lab and we tackle these.
Indeed, you are. Indeed, you are.
Some days I do feel like a ninja with my cat lab equipment as my sword and try to fix those blockages like a gladiator. Some days I'm in the office sitting across lovely, folks like yourself. Sometimes cancer survivors, sometimes people who are actually going through active chemotherapy, sometimes people who have never had any disease, and sometimes people who have chest pain symptoms. No matter what the issues are, we try our best to sit down with them, help them come up with a game plan. I always tell them that part of our job is a fortune teller. We don't have a magic 8 ball, but we have some tools that tells us, that what is the future risk of cardiovascular disease without any intervention, and what do we need to do so we can reduce that risk.
Okay, yes. And you beat me to that, because whilst I was doing a research for this show, I was surprised to read that there were different heart doctors that practiced subspecialties of cardiology. And that's exactly what you were saying now. Because now, arrhythmia is something different, congestive heart failure is something different. So I'm really happy that you've been able to explain all that. Another thing that pleasantly surprised me was that as a medical doctor, you believe in I've read you up and I've read what you're all about. You believe in the power of spirituality. You incorporate that in the practice of medicine. Please explain why you believe this to be important and vital in your practice of medicine.
I believe in spirituality because I believe in science. Science has been telling us that people who happen to be more spiritual, uh, they happen to have better cardiovascular outcomes. So obviously, intuitively, it makes sense, right? We all know that people who are, more spiritual, they happen to have more calmness of the mind. They have better defense mechanisms to deal with whatever else is going on in their lives, whether it's being more resilient,
Mm-hmm.
having a better optimistic outcome, optimistic mindset,
Mm-hmm.
positive attitude, which in turn helps, in terms of keeping people's blood pressure in control, making sure they are more adherent and they're more compliant with their medications. They are more believing, so to say, that everything's going to be better, and they take the medications. But there's also something about the catecholamines and endorphins that come out from very similar to exercise, very similar to mindfulness. These things lead to better chemical release in the body.
Mm-hmm.
Endorphins, certain type of catecholamines, and we have testing. We have biomarkers that we can measure. Some of the
Wow.
biomarkers being the heart rate variability that basically measures your flight and fright response. Your what we call sympathetic.
Flight and fright response.
Yeah, your sympathetic and parasympathetic nerves, right? People who are
Okay.
in constant chaotic mindset.
Mm.
Their body's so used to the flight and fright mindset.
Chaos.
Yeah,
Yes.
their heart rate fails to vary appropriately. Versus there are people whose heart rate can vary very easily and fluctuate because they have not been exposed to chronic constant stress. So
Mm.
the heart rate variability is a biomarker that, the Apple Watch or, the Whoop Band or, Fitbit, all these wearable devices now can measure some
Mm-hmm.
of these biomarkers. And based on these biomarkers, we know that people who have certain biomarkers tend
Mm-hmm.
to do a lot better. Science has proven that people who are more spiritual end up having better cardiovascular outcomes. And the opposite is also true. People who have more depression, more anxiety, more psychological issues will unfortunately end up doing poorer when it comes to cardiovascular disease as well.
I believe you because that was why I said I was pleasantly surprised that you incorporate spirituality. I'm a very spiritual person, and I also believe that that really helped in making me overcome some of the crazy periods when I was undergoing my cancer treatments and also during the process of healing and recovery.
Absolutely.
Mindset, like you said, having
Well, I think
hope,
science has obviously told us the same thing that people who have more positive attitude,
positivity.
100%, 100% they do better than the counterpart when it comes to cancer treatment as well.
Yes, yes. That's wow, that's fantastic. So what symptoms would you say indicates a heart-related disease? What
So
symptoms should we look out for?
So obviously, chest pain being number one, the classic book definition is what we call angina. And if you look at the old textbook, it will typically be a man who is smoking and he has crushing pressure-like dull discomfort in the chest that radiates to the left arm and jaw,
Mm.
along with some sweating, palpitation, and shortness of breath. That's the classic book definition of heart attack or any kind of cardiac chest pain. Unfortunately, less than 10% has all these things, right? So sometimes people get this vague discomfort. They get this vague uneasiness in the chest area. Sometimes they just profusely sweat and they feel like impending doom, that something bad's happening, but they don't know what it is. Sometimes the pain is in the jaw or the back area. Sometimes it's just very unusual shortness of breath, where which happens upon walking, sometimes even at rest at nighttime, what we call orthopnea or paroxysmal nocturnal dyspnea. So these are symptoms often related to heart blockages. In women, unfortunately, you know, all these things are studied in men. So we know that this is how men are supposed to have their symptoms. None of the science in the past used to include women. So a lot of this, we don't even know how heart disease is present in women. We do know that women tend to have different type of symptoms, and unfortunately, those symptoms often get ignored. Not because people want to ignore, what they're saying. It's just we don't have the pattern recognition that we need. So women typically tend to have more abdominal discomfort. Sometimes they have more gas-like symptoms. They don't have that classic pressure-like
On the
discomfort.
chest.
Yeah. So our definition of what heart disease symptoms are, it continues to broaden out.
Mhm.
Arrhythmias will cause palpitation. Sometimes people feel like they're gonna pass out. Most interestingly, there's a lot of heart disease which is silent, which means it's completely asymptomatic. And this is the biggest caveat. That a lot
That
of
is scary.
it is truly scary. But once you go through that scary part, you can recognize that okay, so heart disease can also happen in folks who are completely asymptomatic, but there are ways to detect it. So that's why it's essential and important that you focus on your risk factors. If people have risk factors, they need testing. They need to make sure that they're proactive, talk to your healthcare providers, see if you need electrocardiograms, which is simple 2-minute test, EKG is what we call. Nowadays, you can even do it with a phone. You can get further testing with stress test if you meet those, if you have further risk factors, and you can detect disease. But asymptomatic disease, heart disease, is a very huge problem and it's very common, especially
Mhm.
if you're diabetic and old, you get this problem.
Absolutely. Thank you for that, for really encapsulating that. While undergoing chemotherapy, I was warned by my oncologist that possibly I would have some effects, heart-related, chemo-related effects on my heart. And this was really, really, this, drove me crazy for those, during those times. But why is this so, that these, what is it, interventions affect the heart? Why? And
Yeah,
so
so
terribly too.
yeah, chemotherapies, unfortunately, especially with the breast cancer, but with a lot of different type of cancers, they do have the cardiotoxic side effects, especially the adriamycin, which used to,
Cardiotoxic, right?
yeah, the adriamycin, which used to be a big,
I
it,
used that. That was used on me,
still is,
adriamycin. Mm.
it still is a mainstay for a lot of breast cancer patients, and it unfortunately tend to have a major cardiac effect. So
Oh
there are
Lord.
different chemotherapies, and they have different type of cardiotoxic or impact on the heart. Adriamycin, obviously, or any anthracycline, which is the broader name for these kind of chemotherapies, which tend to have a lot of impact on the heart. Doxorubicin, which is the other very common one, tend to have a lot of 5-FU. There's a lot of different chemotherapies which we are learning more and more that can impact the heart. Part of the reason is the way chemotherapies are designed is to cause cell destruction, right? So along with the good of it, which is destroying the bad cells, sometimes it can cause further damage and destruction of the cardiovascular system. It can cause cardiotoxicity in multiple different ways. One of the ways what we call dose dependent, which means more chemotherapy a person gets, higher the risk. The other way is what we call idiosyncratic, which means that you're exposed to certain chemotherapy even for a short duration, you could get cardiac effect. Now, the good news is a lot of this effect you can monitor and watch, and you can keep an eye with different scans and stuff. So I can go in more detail about what are some of the top effects, but it basically is a whole spectrum of cardiovascular disease covered. People can get heart attacks or coronary artery disease, on chemotherapy. They can get weakness of the heart or cardiomyopathy. They can get various arrhythmias, which is not uncommon with the cardiovascular disease. So all those things can possibly happen. But as I said, oftentimes it just requires monitoring, with scans,
Okay.
with radiologists, doing stress
It
tests.
can't be escaped. You have to go through that and it has to be monitored, right? There's nothing else to do.
Right, right, exactly. There's nothing.
Right. That's good. So how can you've already said that monitoring and being able to identify, a lot of people don't know what they're going through. That I still remember my cousin had a stroke and he didn't know he was having a stroke until he fell on the ground. So how can one identify this before it gets to the stroke part, where you
Yeah,
fall on the floor and you have to crawl and all that? Why,
yeah, no.
how does it get so bad to that extent?
So stroke is obviously one of the scariest outcome, if you ask me. A lot of people
Mm.
actually, when we see in the office, they're not afraid of death. A lot of these elderly folks, you ask them, they say, "Oh, if I go, I go." And I always say, dying without any symptoms is often a luxury that not everybody is given. Sometimes the first presentation is a stroke, and it may be non-fatal, which means that you may survive, but then survive with a lot of bodily limitations. Where people lose their speech or one side of the body function, etc. So stroke is truly one of the scary scenarios.
Hmm.
So the number one thing is if somebody is having active stroke, this is one of those things where immediate attention and going to emergency room, you can actually prevent long-term impact of stroke sooner you go to the hospital. There's a lot of time we can give this clot busting medication, either through the catheter goes in the brain and bust the clot, or just systematic, and you can avoid it. So recognizing stroke symptoms early on is, if someone's having active stroke, you should not be wasting any time.
Hmm.
The more important question is, how do you predict who's gonna be at risk of stroke? And it's very similar to cardiac disease. It's a little tricky thing. We have few tools in our hands, which is monitor your overall health. So what are some of the 5 big risks? And this is an overlap, right? People who have heart attack are the people who have stroke. People who have stroke are the same people who have heart attack.
Hmm.
The big five, as I call it.
The big
Okay?
fives. Okay.
Diabetes, high blood pressure, high cholesterol, smoking, and family history.
Hmm.
You have this big five, or even one or two of these big five, get attention. Ask your doctors or your healthcare providers that is there risk of heart attack and stroke. And
In other words, when you say family history, hereditary, right?
yeah, hereditary, yep, family history
Okay.
of stroke problems. Ask your doctors and healthcare providers, what can I do to make sure I don't have risk factors? And we have tools like electrocardiogram will tell us something. If you have an irregular heart rhythm, what we call atrial fibrillation, you have a risk of stroke, and then you need to be on appropriate blood thinning medication, which drastically reduces the risk of stroke. If you have trouble with breathing or shortness of breath or chest discomfort, obviously you need a stress test. Without any of these risk factors, we have guidelines. They say that certain people should be on certain blood thinner. We have guidelines saying that cholesterol, there is no right cholesterol number anymore.
Hmm.
Somebody's cholesterol at certain number is okay for them, but not okay for somebody else.
Mm-hmm.
So it really, the therapy has to be tailored to an individual.
And to the individual's lifestyle, I think, as well.
Lifestyle, individuals, future, cardiac risk profile. There is something called Framingham risk score. So Framingham, Massachusetts, they did the studies back in 70s and 80s. They looked at thousands and hundreds of thousands of normal folks, and they've been following these people over decades and decades and trying to see, what happens. So based on those studies, we can predict. We have calculators to predict that what is your 10-year risk. 10 years from now, what is your likelihood of getting either a heart attack or stroke or potentially dying from it? And based on your Framingham risk, we have tools like putting them on a cholesterol medication, putting them on baby aspirin, which is a little bit controversial nowadays, but it used to be a big thing. And just medical, just risk factor reduction. Who needs more exercise? Who needs to lose weight? Who needs to get proper diet? Who needs and now we are learning more and more, going back to our spirituality and mindfulness and all those things.
I'm coming to that diet part because I need to ask you certain questions concerning that. Yeah. So, as regards, we've already talked about the high blood pressure and leading to stroke sometimes and all that. What does the heart scan do?
So it depends on the type of the heart scan. Scanning is basically taking an image of the heart. Image of the heart can be taken multiple different ways.
Mm-hmm.
Can be a simple ultrasound, or the official word is echocardiogram.
Mm-hmm.
It could be more commonly in people going through breast cancer therapy. We do something called MUGA scan. So MUGA scan is a nuclear stress test where we inject.
Called what? I didn't hear you, please. The
MUGA,
scan.
MUGA, MUGA scan. It stands.
Oh, MUGA, MUGA.
MUGA, yeah. So it's a thallium scan where we inject this radioisotope as a nuclear agent, and heart selectively uptakes it and gives an exact quantified objective number of the overall pumping capacity of the heart. A lot of people who are going through breast cancer will get regular periodic heart scan or MUGA scan. But there's also cardiac CAT scans. There are certain very specific CAT scans which can give a lot of information. And then finally there is MRI, which is a very new modality, but giving us tons of tremendous information. So this is one of those professions or fields where we have so many different tools now. So we really need to know when to use what. Not everybody needs cardiac MRI. So it really again comes down to individual therapy, individual tailored.
Tailored therapy, right?
An echocardiogram versus who needs the MUGA scan, who needs the stress test versus who needs cardiac MRI. But all of these tools have tremendous roles, and they're all continuing to get better. So this is something I truly am very excited for, because our profession, cardiology in general, is at the forefront of medical advancement, and things are changing dramatically. I mean, I graduated 11 years ago now from my fellowship, and I started 20 years ago my med school. Within this 20-year time span, since I started med school until I graduated fellowship, there was so many advancements. And since I graduated fellowship up until now, the field is just continuing to just
explode. Yes.
And for better, and there are conditions which we could not even imagine tackling.
Mm-hmm.
Now we are handling them, and not only that, like one of the biggest example is aortic stenosis. When one of the heart valve gets severely narrowed, more than 50% of the patients were not even candidate for open heart surgery. And now we can fix this with what we call TAVR, which is putting a catheter from the groin and putting a brand new valve through it.
From the groin?
From the groin. And
are you serious? So you put a catheter through there to the heart?
New valve, and you can be discharged home in 2 days.
Wow.
And this was a pipeline dream. Like we heard about it in med school days. They said this may come into therapy one day. when I graduated from fellowship, this was just starting to happen, and now it's happening at so many places. And we are doing like hundreds of towers throughout the year.
That's amazing. What science is doing now, it's really exploded in the 21st century. Wow, that's awesome. So, for example, I'm a caregiver and, of course, taking care of a patient. What are the signs that I look out for to know if my ward is having a heart attack? What is it that I can look out for?
So I think I would say look out for symptoms. If somebody is having for heart attack specifically, you gotta look for angina, which is chest pain. Again, don't I won't like wait till they have the classic book definition. I always joke that heart disease itself does not read books,
Mm-hmm.
so it can come in a very atypical fashion. So if there's some things for heart, this is a heart health month, so we need to keep it as any kind of chest discomfort. If it's pain, if it's pressure, if it's tightness, if it's achiness, if it's either it's crushing or whether it's dull,
Mm-hmm.
seek attention. If it's an unusual pain in the left arm or the jaw, get attention. If it's shortness of breath, which is out of proportion, people can't even walk one flight of stairs and they're running out of breath,
Mm-hmm.
attention. Sometimes dizziness, lightheadedness, which is unusual. People feel like they're gonna pass out or they start sweating a lot, get attention. And these are things people should not miss. Again, everything comes down to your risk factors. If somebody is
Yes.
older, again, that definition of old continues to change. So I would say middle-aged and old. If someone has history of smoking, even if it's a remote history of smoking, strong family history, especially diabetics. If you're diabetic, you have high blood pressure, high cholesterol, these people should really, every symptom should be taken very, very, very seriously.
Okay. Thank you so much for that. Um, for example, I am on high blood pressure medicines and I decide to go off them. What are the pros and what are the cons? That is, if I now decide to adjust my lifestyle, for example, my diet, I don't drink anymore, I don't smoke and everything. But in the past, I was giving blood pressure tablets, and then I've done a complete overhaul in those departments. Do you think it's okay to go off those high blood pressure medications?
So yeah, I think it's okay if you can truly demonstrate the blood pressure is perfectly under control without any of these medications, right? And this is the tricky part because oftentimes blood pressure is not perfectly under control, and the definition of perfect control of blood pressure also continues to change. We used to think like the top blood pressure number of 140 was normal. Anything below 140 we didn't care, and then we learned, well, even at below 140 people were getting impacted by heart disease. So the definition changed to 135. Now the top number of normal should be 130 or lower, and we call anything below 120 as normal. So the bar is coming close because we are learning that every 10-point increase in blood pressure more than normal causes 10% higher risk of stroke.
Oh my goodness.
So high blood pressure can impact heart and heart disease in multiple different ways. Stroke being, as we said, one of the scariest ways it can impact. So blood pressure control is very vital and very important. The only way I would recommend getting off the blood pressure meds is you truly have demonstrated your blood pressure is staying under control normally. And blood pressure is something that you can't really fix it in a doctor's office on one visit. This is something that people have to take control themselves.
Mm-hmm.
The blood pressure machine nowadays is very easy, and we actually have a watch now which can do blood pressure monitoring.
Mm-hmm.
Omron makes a watch, so you can do blood pressure monitoring. But like simple blood pressure monitor, you can get it from any pharmacy or online. Check blood pressure, and I would say check blood pressure 2 or 3 times during the day. Document those numbers. If all the numbers are coming back normal, only then, after talking to your healthcare provider, you need to have a conversation because sometimes the blood pressure meds are helping not just the blood pressure, but they're also helping kidneys. People have proteinuria, they
Mm-hmm.
sometimes need protein in the kidneys. For them, controlling blood pressure is even more important to protect them from getting future
Kidney damage.
kidney damage.
So you would advise that people, no matter what people, even if they have a change of a positive change in their lifestyle, they should still stay on their blood pressure med.
No, I think a dramatic change in lifestyle, which means like you were never exercising and now you're doing great exercise. You had
Okay.
really poor diet habits. Now you are avoiding salt. You are, eating very healthy. You're doing the mindfulness. It is possible to get off the medications.
Mm.
Absolutely possible. But it should warrant a conversation with your healthcare provider, because
Mm-hmm.
sometimes as a person you may not recognize, but you have this signs that high blood pressure has already impacted your heart. So
Mm-hmm.
EKG can tell you if your heart muscles are very thick, what we call left ventricular hypertrophy, which means the high blood pressure is already affecting the heart. So it's the next stage of high blood pressure. Those people, it's difficult to just stop the medication because you could potentially impact yourself in a much adverse way. So it requires a conversation. It requires, for lack of better words, a little bit obsession with getting healthy. If you are a little bit healthy, saying like, it's like saying I want to be a little bit pregnant. It doesn't happen that.
You have to be intentional.
Yeah, you have to go 100%. You have to say, I want to be obsessed with my health and my blood pressure. I'm going to check my blood pressure 3 to 4 times a day. I'm going to
Mm.
do everything it takes, and you completely take charge and then demonstrate that everything's okay. Then you can go off the meds.
Mm-hmm. So when would you ask somebody to get a pacemaker?
Pacemakers are for people who have cardiac conduction abnormality. So heart is a pump, right? So its job is to pump. The pump has plumbing and pump has electricity. So the plumbing is the blood vessels and blockages, what we talked about, and electricity is also a very essential integral part of the heart function.
Okay.
Oftentimes, people who have blockages, some people who are older, some people who are on certain medications, the hearts tend to start running very very slow. It
Slow.
depends on where, and it's because the electricity in the heart, the electrical conduction in the heart is slow. Question is, where is it slow? Not everyone
Mm.
who has a low heart rate needs a pacemaker.
Mm-hmm.
So it has to be within the heart conduction system. The pause or the slowness has to be at a certain level, what we call the AV node typically. Um, some people who are younger or very athletic, they tend to run a slow heart rate, and that's normal. So it depends on whether somebody passed out or not. If you have a low heart rate and you passed out, there's a chance you may need a pacemaker. If
Mm-hmm.
the level of conduction abnormality is at a certain level, what we call AV node or below, then you need a pacemaker. Some people can't really keep up with their exercise regimen because the heart rate fails to rise up to a certain degree, and what we call it's called chronotropic incompetence, which means their heart is not competent enough when you're exercising. It's okay when you're resting, but when you start exercising, you can't keep up the heart rate. Then pacemaker helps. We used to
Okay.
put pacemaker for a lot of other stuff, and we recognize and learned that pacemaker doesn't solve it all. So we keep it on very judicial way, only when you meet absolute criteria. That's where pacemaker helps.
Oh, great. So it's the electricity of the heart, basically.
That's right.
That's when you require the pacemaker, right?
That's right.
Okay, that's good. I've also, as regards nutrition, sorry to take you back because when you were speaking, I wanted to talk about nutrition. I read articles about the keto diet and intermittent fasting, which they say has a positive effect on our hearts. Is this true from your point of view?
It intuitively seems true. It's difficult to, we
Okay.
as a purist in science, you want to rely on data, right? You want to look at thousands of patients who tried like, a particular type of diet versus a thousand of same equal patient who didn't try that diet. And then, we want to follow them for few decades, if possible, or at least like 5 to 10 years, and then see who did better versus not. Only then, so that's what we call a randomized control trial. Only then you can make a true scientific assessment of what works
Mm-hmm.
or not. Problem is these studies are not that easy to do when it comes to diet because people tend to flip their diets very frequently. So
Mm-hmm.
the data that come out with all these claims are often muddy. They're not very clean data. Not because people are trying to conduct these trials wrong. It's just they are difficult studies to perform. Having said that, we have animal lab data. We have small sample size data with a shorter duration, and all those things are definitely supporting intermittent fasting as well as keto diet. So they both have a benefit, um, without a doubt. The one diet that is truly demonstrated cardiovascular benefit is Mediterranean diet.
Mediterranean diet. Yes, a lot of people say that's the best,
Yeah, so
actually.
that one has the most data right now.
Mm,
But again, absence of proof is not proof of absence. So
absolutely.
oftentimes you have to go with what seems right. I mean, like plant-based diet. A lot of people think plant-based diet is great, which has a lot of benefit. And then now they did an observational study and they found that people who had plant-based diet only in United Kingdom, they had more stroke.
Seriously?
Right. But now this is where statistics becomes very tricky
Hmm.
because it's association and it's not causation. It didn't cause stroke. They just found statistically higher incidence of stroke. And
Okay.
there is, so that's why it becomes tricky. You have to look at long term, and that's why we don't like to just look at backwards, what we call retrospective data. We like to look
Mhm.
at prospective data.
Forward.
The only prospective trial we have is Mediterranean diet, but we know that plant-based diet has many other benefits: less risk of heart attack, less risk of coronary artery disease. Same way with ketogenic diet, there is benefit. Intermittent fasting for sure is also demonstrating a lot of benefits. So the jury is out, but if you are thinking about keto diet and intermittent fasting, that tells me that you are going to do 10 other things which are good for your body.
Mm-hmm.
So I think there is a higher chance that people who are into this diet will in general have a better outlook toward their overall health, and they're going to do better regardless.
Okay. One thing for sure is I love Indian food. All the peas, the chickpeas, and everything I find so healthy and so good, honestly. So
Well,
that
let me
is
Indian food, it's just like any other cuisine. There is a healthier aspect, and then there is like super unhealthy.
I know, but I just love the spices, the healthy spices, all in the heaps and everything. It's
Actually, believe it or not, there is some not with the Indian spices, but they have some evidence
Moroccan and all that.
chili pepper.
I eat a lot of pepper. I'm African, so I eat a lot of pepper. I cannot do without
Chili
pepper.
pepper actually has amazing cardiovascular benefits.
Mm.
And they did a study in Italy, and they found that Italian diet, and when there was higher level of chili peppers, people ended up doing a lot better because they have some antioxidants. They have capsaicin, which is a type
Mm-hmm.
of chemical in the chili pepper, which actually end up doing better. So I can't wait to see when somebody studies like Indian diet, but the good Indian diet, not the curry with like a lot of butter and stuff.
Yeah, the heavy ones. Yeah, there's a good and bad of everything in life, you know.
Right.
Either we go overboard or underboard, you know.
That's right. And
That's
sometimes
great. This
we
has
have
been
to use that.
so eye-opening and interesting. So, what advice would you give to that patient or that survivor or that caregiver that is watching right now to say, listen, this is what you need to do to keep your heart healthy?
I would say stay positive. Okay, heart disease happen to be very scary and dangerous, and still number one leading cause of mortality in the country. But heart disease is also preventable for the most
Mm-hmm.
part. Okay, so seek attention. Make sure you talk about your cardiovascular goals with your healthcare provider. And what else can I do better? More often than not, people are undertreated. So oftentimes people need certain like better control of diabetes, blood pressure, cholesterol. Get those. Exercise is great. Focus, and more you move and more you're exercising, the fitness is better than fatness. They
Mm-hmm.
study this.
Mm-hmm.
So just it doesn't matter what body shape or body weight you are in, as long as you're exercising, you're moving, you're allowing your heart to function. Heart has what we call myocardial oxygen extraction. So more fit you are, it helps. Sleep. Sleep is one of the things that people oftentimes ignore. They like especially in today's day and age, everybody's hush, hush, rush, rush. Proper sleep actually helps. Mindfulness we talked about, gratitude, all those things help. So really healthy outlook towards life, and try to take control. And if you are somebody who has more sickness, get attention. A lot of heart disease is fixable, treatable, preventable, and manageable.
Manageable. Absolutely. And with all this advice you're giving, how do you unwind? You know,
That's the
with all that you do.
magic trick, and that's the magic question, right?
Yeah.
It's not easy. I'll be the first one to admit, right? It's very easy to be the one giving the advice. Preaching is much easier than practicing. I I try to focus. I try to have a balanced life. I'm not one of those people who exercises every day, 5 o'clock in the morning. I wish I would. All my resolve goes up at 5 in the morning. But I always tell people it's not about the healthy habits. Everyone knows what are the healthy habits, but yet some people will do it and some people won't. The key is in knowing how to form a habit and how to sustain a habit. So habit formation and habit maintenance is a science by itself. So I try to learn that. Like, how do you create habit? So there are apps now that you can just go on those apps and that will help you fulfill those things. So I try to exercise, I would say, anywhere between 3 to 4 days a week. Nothing crazy, but
What do you do? You take walks or
cardio,
what?
different type of cardio. Whether it's I like the high intensity interval training or HIIT training, which allows me to have a full body. So it's not. I often used to do like treadmill or elliptical or just run outside. I live in New York City, so I would run by the river.
Mm-hmm.
Unfortunately, you can only do that few months in a year. Treadmill and elliptical helps, but it becomes a little bit boring. So I like HIIT training. I feel like I'm in good shape right now that I can do the HIIT. It allows you to use different muscle groups.
That's
So
HIIT, right?
HIIT, yeah.
Yes, I've read about that. Yeah.
So basically, you are using different muscle group in a quick succession. You wait a few seconds, then you start the other muscle group. But it's more fun because you're doing burpees, you are doing a little, running around, you're doing the mountain climber exercise, and those
You're doing burpees. Oh, my daughter does that. Oh la la. By the time she comes back home, she's flat out.
oh, but you can do it in proportion, right? Whatever your body allows. So that's the
Mm-hmm.
kind of exercise I do, like 20 to 30 minutes, but it's good. It forms, good. You can also do 7-minute fitness. There is
Mm.
science saying that you can do 7 minutes of 30 seconds each of 14 different exercises. You know, and
Awesome.
that can involve every muscle group, allow your heart rate to go to a appropriate level and come back.
Mm.
Obviously, for cardiovascular, you want to do 15 to 20 minutes, not more. I do some weights, and stuff like that. I do focus on my sleep. I wish I could sleep a little bit longer than I do, but I try to catch up when I can. Sleep is also about the quality of sleep. It's not just the quantity of sleep, right? So try to create an environment where you can sleep more peacefully. I do try to meditate, as much as I can. I'm on my day 5. I keep a streak. I broke my streak, and then I'm back on the horse now. So I'm excited. I use Headspace, which is an app, and that keeps you grounded. Brings you to the core. Use that for anywhere between 10 to 15 minutes in a day. Uh, Eat healthy. I try to avoid fatty food. Just try to do it all a little bit. Every tweak you make, it adds up as time goes. So
Absolutely. One thing I wish I could do is sleep. I hardly sleep, and that happened after you know, coming out of cancer and everything. I think it's the drugs or what, I don't know. So I don't force myself to sleep. If the sleep comes, yes. If it doesn't come, then I'm being productive in one way or the other, like writing my show notes, that
right.
kind of thing.
A lot of people, sleep is another talk for an hour by itself, I would say. Um, a lot of people do go into that mindset. Some of it comes down to what do you value. As I said,
Hmm.
it's not just the number of hours; it's about the quality of sleep also. The
Yes.
sleep has 4 phases.
Quantity.
So, right. So sleep has like REM phase, which is the rapid eye movement phase. Sleep has alpha, beta, gamma, delta, and the delta sleep is the most peaceful sleep, which actually it like recharges your battery. So even if you're sleeping
Mm.
less number of hours, if you're having more delta sleep,
Mm.
actually is better for you. And you can measure these things nowadays. You can
Yes.
use biomarkers that can tell you how well or bad you are sleeping. And if it's really not peaceful sleep, for lack of better words, then there are ways to fix that.
Mm-hmm. No, but when I do sleep, I sleep. But when everybody is asleep, I'm usually doing something else. I hope, well, it's now part of my DNA what to do.
That's right.
But that's it. That's wonderful, Dr. Shah. So lovely talking to you. So before I let you go, um, if you had to do all this all over again, would you walk down the same path?
Absolutely. I feel very
Great.
humble, very privileged to be in this position of helping people with their heart problem, their heart issues. Yeah, I don't see it any other way at this point. I love what I do, and it's truly a privilege. And question is not why would I do it again. Question is why won't I do it again?
Absolutely. That's wonderful. We are so privileged to have people like you taking care of us. Thank you for your goodness and for everything you do to, keep us still standing on this side of the divide.
Thank you so much. Very kind words. I appreciate it. The privilege and pleasure is almost always ours.
Thank you so much, Dr. Anuj Shah. Been a privilege talking to you and learning so much from you. And I hope that very soon you'll be able to come back on and we can talk about something else, because
Thank
I know you're an all-rounder. So
well,
you'll
thank
be
you so
able
much.
to give us something.
Thank you so much for having me. Thank you for the kind words. I would love to come back. I'm also,
I'll visit your place, your
I
practice.
would love to,
I will definitely. I'm in New York City as well, so I'll visit you.
perfect. I have offices in New Jersey, four offices in New Jersey as well. I live in the city. I'm sure my link and email will be there somewhere on your the YouTube.
Email, yes,
If anyone
and YouTube and
listening to this has
everything.
any questions or issues they want to ask us, please, it will be my pleasure.
They will forget it. It's going to be there and on all my platforms, and they can reach out to you. Now I'm close to your office manager, Mr. Patel. So now I have his email. I'll
Perfect.
go straight to him. Okay. Thank you so much, Dr. Shah. It's
Thank
my
you, Greg.
pleasure and my
Have a
honor
great
to have
weekend.
you on my show.
Thank
And thank you for reaching out as well.
you.
Thank you
Take care.
so much.
Yeah.
Let me just sign off. There you have it, my dear audience and friends. You've heard from the amazing Dr. Anuj Shah. You'll be finding out more about him when I put his links on my platforms. So make sure to follow Dr. Shah's advice in taking care of your heart health. A healthy heart makes a healthy man. If you haven't yet joined our community, please like and follow us on Facebook and subscribe to us on YouTube, and don't forget to share. Thank you so much and wishing you love and light. Bye-bye. Bye-bye, Dr. Anuj. Thank you.
Yeah, Grace, thank you so much. That was wonderful.
God bless you. Bye-bye.